Good afternoon, friends and partners. I'm here with you today on behalf of National Health Service of Ukraine. I will brief you what's been on strategic scope of activities of NHS and facts and figures of the last week. So the introduction of the program of medical guarantees in Ukraine have changed many things in healthcare system. One of them is participation of private business and providing services to a patient for public money in private facilities. National Health Service of Ukraine has contracted facilities which are not only of municipal ownership, but also private enterprises. In particular, as of today, the National Health Service has contracted 517 private enterprises for providing primary health care and 63 facilities for providing specialized medical care. The number of private primary health care facilities that has been contracted by NHS is growing every year. In particular, at the beginning of 2019, there were only 204 of them, and at the end of 2019, 416, and as of today, 517. It stimulates competition among facilities. Patients are free to choose any doctor or facility to get the best treatment or service. At specialized level, NHS has contracted private medical facilities for the following services: 34 facilities that has been contracted for providing outpatient specialized care, 34 for providing services for patients to conduct endoscopic interventions, 4 ones were contracted for providing medical rehabilitation services, inpatient surgery, cancer diagnostic and chemotherapy services for patients with cancer, and 2 for myocardial infarction, hemodialysis services, and therapeutic inpatient care. Now I will continue to give more details on the services that have already been included in the Program of Medical Guarantees 2020. Today I will tell you a little bit more about the emergency medical care and treatment of hemodialysis. The NHS has contracted 25 emergency medical care centers to provide pre-hospital emergency care to patients, as well as to provide such care to patients with COVID-19 related cases. EMD centers have already received 1.5 billion hryvnias from NHS for providing care in patients in April-June. Another 271 million hryvnias was paid for the pre-hospital emergency care of patients with COVID-19 related cases for the period of April-May. The provision of pre-hospital emergency care is free of charge for the patients. In particular, it includes providing pre-hospital emergency care at the scene and during transportation of a patient who needs medical support at medical facilities. The patient does not need a declaration signed with a doctor or referral for him to receive emergency care. In 2020, NHS proposes an increased rate for emergency medical teams that follow the correct patient route, in particular for patients with heart attacks or strokes. Patients with chronic kidney disease can be treated by extracorporeal hemodialysis in 86 contracted by NHS medical facilities. Among them, there are 2 private ones. As of today, these facilities have received 538 million hryvnias for the period of April-June. Private medical ones got 21 million hryvnias. A patient is free to choose the facility to receive hemodialysis. It can be municipal or private, which has been contracted by NHS. A patient can choose a facility closer to the place where he or she lives, or any other that he or she likes. One can find the full list of such medical facilities at NHS website. The treatment is free of charge regardless of the form of ownership of such facility. The only thing a patient needs to receive a treatment at no cost is referral from his or her nephrologist. Also, I want to tell you a little bit more about our current work and measures that were taken against COVID-19 pandemics. More than 1,600 million were paid by NHS for facilities providing treatment to patients with COVID-19 related cases in April and May. Also, in April-May, 11,146 patients with coronavirus infection received inpatient care at the medical facilities designated for COVID-19 related treatment. 1,971 patients received medical care in intensive care units. Treatment of patients hospitalized with COVID-19 is free of charge for the patients. NHS pays for the services of medical facilities at a rate that includes remunerations to physicians of up to 300% of salary. Inpatient care for patients with COVID-19 related cases is currently provided by 3,042 doctors all over Ukraine. Also, such medical care is provided by 9,126 nursing and paramedical staff. About 3,000 physicians are involved in mobile teams that go to COVID-19 related cases patients. Thank you for your attention and see you next week.